Good morning, everyone. This is the Revised MnCHOICES application launch webinar for Wednesday, August the 9th. We're going to go ahead and get started. This is the MnCHOICES team who is on the call today to answer your questions that you may have. Thanks, policy folks, for joining today's call and providing the support users need to get their questions answered. Much appreciated. So as you know, this session is being recorded. We will use you can use web audio to listen to this session. Please know that you're all muted. To ask a question, you'll raise your hand. We will acknowledge that you've raised your hand and we will unmute you when it's time for you to ask your question. Otherwise, everyone will stay mute. So again, I just want to go over ground rules, and the reason why I want to go over ground rules is sometimes we can have some unintended frustration that leads to just some difficult conversation between both agencies. And I just want to acknowledge the fact that this is really hard work that we're doing, that it's stressful. And the reason why we want to have some ground rules is because we know your intentions, that we want to set an atmosphere for good intentions and respect. We know that you have that for us and we have that for you. We just want to be able to say that out loud. We're really here for the DHS staff to provide you information. We have information to give you from DHS. That's our role, to do that and to train you and to support you. And it's your role as agency mentors to attend meetings, to ask questions and learn. And we would really appreciate it if you are feeling some need to give DHS feedback, that you use the MnCHOICES help desk form to do that rather than do it during this call. We may not be the right person that information needs to be sent to, and this just guarantees that if you have any feedback, it goes to where it is intended. So thank you everyone for understanding that. We appreciate your attendance today, and let's go ahead and get going. So the objectives for the launch webinar, as you guys know, is to really make sure that you understand what's going on now that you are launched. If you've been launched, you've had a chance to kind of learn these objectives, and it's our job now to support you in the launch and to make sure you have what you need to move forward. So here's today's agenda as I have it. We are going to go through some reminders on the revised MnCHOICES. I'm going to review the July release items and the one addition to the current functionality document, the new version 6. We're also going to talk a little bit about some issues that we're seeing you experiencing and try to give you some tools so that you can resolve those issues. And then we will review a few resources. Scattered throughout these 5 agenda items will be opportunities for you to ask your questions. Please maybe jot yourself a note when you have a question that comes up as we're talking through this so you don't lose it, so that when there is a time for question, you can ask it. So let's go ahead and get started. So let's talk a little bit about revised choices reminders. So a couple items I wanted to make sure that you were aware of is we know that office hours is the first Friday of the month. We have it monthly through June of 2024. It used to be every other month. We've determined for the sake of the support for a launch, it needs to be every month. Please know that our next available one will be in September, and since September the 1st would be the first Friday of the month, we've moved the office hours call to September the 8th to accommodate time off for Labor Day weekend. We have a launch webinar today for August the 9th. We have another one on September the 13th. And then we also have a MCO call-in session on the 16th, and MCO delegates will get more information about that call the day before or day of the session so that you can call in. But please save that on your calendar. You should have gotten a communication on it with date and time already. The other thing I just wanted to remind you of is that we are in a phased launch. I will not go through the detail on this document, or on this slide, but I wanted you to know we're currently in phase 1. At the bottom of the slide includes the e-list link with the description of each of the phases and the expectations. The content that is currently on the slide talks a little bit about what our expectations are for you. You have to have up to 10% of your users completing health risk assessments and support plans in the production environment. And that it also then talks about allowing staff to continue using legacy systems and conducting county of location assessments in the MnCHOICES M&A application 1.0 for counties only. We are going to be moving, oops, you like my looing ahead instead of looking ahead. We will be moving to phase 2 soon. It's coming up very quickly. And so we just wanted to remind you that you'll be moving up to have up to 30% of your users completing HRA's assessments and support plans in the production environment. Your staff will be able to continue using legacy systems for the remainder of that 70%, and the COL assessments will continue again either in MnCHOICES assessment 1.0 or in the revised MnCHOICES for the county at their discretion. So we're opening that up to you being able to do that as well. So we're moving into phase 2 quickly. The summer is careening on and we're moving towards fall. So thank you, everyone. I'm hearing noise in the background, just so people know. There, I fixed it. So this is the outage schedule that we were recently provided. I'm providing you the release schedule for 2023. So you can see these dates. The releases, I'm believing, will remain happening at 4:30, but just so that you have them and you're aware of them. I'll be looking at updating the County Link outage schedule as well. We are moving into a new phase of the production environment and having regularly scheduled releases with regularly scheduled content. And we will let you know the content for each release as we have them available to you. And we will do like we have been doing as far as giving you here's what's been changed and then making sure we go over it at a webinar. So I'm going to allow for questions around the reminders. If you have any clarification that you need on those, I will take those. If you have other questions that go beyond the scope of this section, then I will ask you to hold them. Are there any questions that we should answer around these reminders?
Teresa, we have one question. Emily Gerard. Hi, Emily.
I am just, could you tell me what the time is for that MCO call-in that's next week? I was trying to do a bunch of digging through past emails and announcements, and I haven't been able to find anything, and it wasn't on the office hours link either. For the website.
So sorry, I'm going there right now so that I can tell you.
Thank you.
So let's see.
So this is Rakia. I can answer that question. The MCO and MCO delegate mentor webinar that's scheduled on August 16th. We have a time from 9:30 a.m. to 11:30 a.m.
Awesome. Thank you. Do we by chance know, and if it takes a bunch of digging, it's not important, but do we know when that announcement may have gone out? I'm just trying to figure out if I missed something. The first I had heard about this was last Friday's office hours, so I'm just curious if I'm maybe not on the right list. I normally do get all the MnCHOICES emails.
You will see something. I have it on my schedule to send out the call-in instructions on Tuesday the 15th.
Yeah, I was just more so wondering for like planning ahead, because getting instructions the day before, and if I hadn't been on office hours last week, I just wouldn't have known about it.
We did it about a month ahead. I'd have to go. Rakia
Okay.
can look it up and maybe put it in the chat for you.
Awesome.
I just don't want to spend the time
Nope, totally fine.
looking for it. So thank you.
That's all I needed. Thank you.
Yeah, you're welcome. Other questions?
We have no other questions.
Okay, I'm gonna go ahead and go
Oh,
on.
I'm
so that
sorry. Actually, I'm sorry. I missed it. I was looking at the wrong thing. Kathy McMahon from Hennepin. Hi, Kathy.
Say for the new release dates that are listed, like the
Mhm.
August 25th, September 22nd, etc. How long do those last? Because I'm going to put them on our calendar. It'd just be good to know. Is that for the whole weekend?
It should be similar to the last one that we sent you information on. So would that have been July, where it said, we basically say it starts at 4:30, and then usually what we do is say, you know, if you work on Saturday or Sunday, it's at your own risk. But um, I don't know what time the release ends on that Friday. I don't know how much time they use. I'll have to look it up for you, Kathy. I can't tell you off the top of my head.
Okay, thanks. That would be helpful. And I
Yep,
always
I
get a
hear
little
the
freaked
request.
out
Yep.
when you say work at your own risk. That's kind of scary, just so you know.
Yeah, I mean, we
Thanks.
just do that as a caution, right? The reality is the release should be done by whatever time it says it's done. You haven't gotten the all clear. We haven't given you the all clear. If they end up working on it longer, you won't know. We won't be able to tell you because we're not at the office on Saturday. The caution is only there for that reason. It's it's not there for any other spooky, scary reason.
Thank you.
Yeah, you're welcome.
Okay, Jessica Nicholson.
Quick question regarding the outage from yesterday. I have staff who logged in and started working in revision this morning, and we haven't necessarily received an all clear yet. Is that okay, or should we be pausing that and waiting for further communication to come out?
Jessica, they're good to go.
Okay.
The all clear message went out a little late. I didn't get confirmation right away to know for sure we could send it out. So the all clear has went out. Um, so they're good to go.
Oh, okay. I must have missed that. Okay. Thank you, Teresa.
Yep, you're welcome. Mhm.
Okay, last question, Rebecca Jacobson.
Teresa, how are you?
Good morning. Fine. How can I help you?
Yeah, I just have a couple questions kind of about the revisions and phases. So when we start looking at getting people into the new MTZ, can you just let us know, is the updates with these new releases happening in prod for the 2.0? Are those also being updated in the MTZ train zone so that it mimics what's happening in production as they get?
Yes. Yes,
So
it
they're
is.
exactly the same. Awesome. Okay.
Yep.
Then I'm just wondering too, as we start to look into the phases and more people are entering in to the 2.0 in production, if we were say to get like transfer cases where someone has done that MnCHOICES assessment in the new 2.0, and our staff isn't all necessarily going to be in, you know, since it's a percentage wise, are we still able to, if we get a transfer in that has had it done in MnCHOICES, able to just still do the legacy documents? If we aren't to that point of our own staff all being in the production?
I can't speak to it because it's not a functionality, it's a policy question, and I don't know who wants to take that one on. Take this question on.
I feel like we need to take that one back. I am just in processing your question and having lots of flags in my head. So I'd like to take it back for further discussion, and we'll get back to you about next steps there.
Okay, thank you.
Unless, yeah, thank you.
Yeah, that's kind of what I anticipated. It would need a little bit of discussion on our side. So I'm going to go ahead and go to the next section so that we make sure we have time for other questions throughout today. So let's talk a little bit about July releases. What happened in July? So we were working from the current functionality document version 5, and there are 6 fixes that had occurred off of that document. So the first one was in regards to split view. There was an issue with split view where it did not display appropriately. It now will display correctly, so you will be able to bring up an assessment on one side and look at it and work in your support plan or whatever you need for work. So again, if you want to practice it in MTZ to get a sense of what it would look like and how to use split view, you definitely can. That item has been resolved. The next one is regard to OBRA-1 and helps brain injury screening documents. So before the release, they weren't editable when you took them offline. So you could look at them to ask questions, but you couldn't edit the documentation in it. Now those documents are editable when they are offline. So we wanted you to be aware of that. And again, this was part of the current functionality document. That's why you see this DHSID is to tell you where it sits in that document if you use it as a reference number. The next one is in regard to the health risk assessment information section. So before the release, when you were in an HRA, you couldn't close it if the person declined or you wanted to pick person declines or is not located. When you chose those, it wouldn't close, and now after the release, it will allow it to close. So you can then take the HRA, mark person declines or is not located, and close that HRA. So it will work as expected, and you'll have good documentation on what you did. The next one is about data retained in the notice of action. So before the release, when you completed the notice of action in the assessment summary section, the data in the not eligible reason types specifically they weren't displaying in the user interface. And so now when you're in the non-eligible reason types, it'll be retained. So the assessment status, when it's changed to complete ready for MMIS, will display correctly, where before it wasn't displaying correctly when that status was chosen. So this is another couple of items that were fixed, and I put them on the same screen because they were shorter for detail. So the first one is before the release, you weren't able to view an electronic signature in the support plan. But now after the release, you can print a signature collected electronically. So you've collected it electronically, but you couldn't view it, and now you can view and print it. And then the next one is, a report was created called the MnCHOICES user last sign-in report. So you could keep track of active and inactive users in the system. So you could, if you had the role of agency reports, for example, or lead agency supervisor, you could go to the report section, pick this report, and be able to look at people's status. But before the release, you had to check all of the boxes to make sure otherwise it wasn't displaying accurately. And now you can choose any one of the boxes and it will display the information correctly. So you could put inactive user and it would display it. You could put, I don't know, I don't remember what they all are off the top of it, but that being the idea that it will now display correctly. We also had a patch on July the 24th, and the reason for that patch is because locations that were managed care were showing up in the county managed assigned locations. So this is my example. I picked on Todd County today. So Todd County's locations should have been Meridian Services Todd, Thomas Allen Todd, and Todd County. But when staff would go in and look at their assigned locations, they would see the MCO locations in the assignment as well. That was incorrect. They were removed. You have to do your work separately, either log in as Todd or log in as Blue Plus and then pick the Todd Blue Plus location to do your work. And so that item was fixed. So no longer will these, what I call ghost locations that don't belong to the organization, no longer will they show up. That was fixed with that patch. There were other releases that occurred that weren't part of the current functionality document, but were important to fix. And so one of them was when you X out of the browser instead of logging out, you weren't always logged out of the revised MnCHOICES application. So now if you X out of the browser, the system will log you out. So you're aware of that. Another issue that was reported was that users weren't able to use the message center to send messages to each other in MnCHOICES. That has also been repaired, so you can message each other inside the system. There were some other issues fixed. So the Bois Forte tribe was misspelled in the drop down for long-term care consultation, so that spelling has been corrected. And the health insurance information section, no longer will you see duplicate Medicare records when a client has more than one span for Medicare Part A and Part B, so that was fixed. And in the LTC screening document, in the printed document, the field LTC County will display all values when a health plan or a tribal nation is entered. It was not displaying all values, and so now it will display all values as expected. The support plan, when you pick a plan, now MnCHOICES will allow more than one type of support plan to be active at one time. So you could have a support plan HRA and a support plan MnCHOICES or open at one time, for example, and it will allow them both to be open, both to be created at the same time. The MCO data reports were missing some data from tables, and so I won't read the list, but just to say that for the assessment fields, that missing data was added to the table, specifically around areas that are very much about MCO data. And then MTZ change, we replaced the OBRA 1 form in MTZ so that you have an updated OBRA 1 form to use and practice with and be able to take offline. So that is all of that. I would like to keep going and talk about the new addition to current functionality. Sorry, I'm gonna see where and then right after that, we'll have a chance to ask questions. So if you want to queue yourself up for questions, you are welcome to do so. So we have one addition. So like I said, we had 6 items that were removed from the current functionality document, and we have one addition. So here's the addition. So the DD screening document doesn't display the correct responses for therapies chosen in the MnCHOICES assessment and well-being domain. And so when an assessor indicates that someone is getting physical therapy, occupational therapy, or speech therapy in that therapy section, the DD screening document printout doesn't show the correct responses. And so our directions are to you that you'll need to review the screening document when one or more of those therapies that I just mentioned are indicated. And then you'll manually need to change the blank screening document to no as appropriate. And there is no error in the no therapies or when all 3 therapies are chosen. It's just that when the 3 that I mentioned, either in combination or separate from each other, are chosen, that an error occurs. So with that, I will take questions in regards to the current functionality changes that I just talked about.
So we have a not anymore. Oh, there she is again. Hi, Maria. Hang on. Maria, you're unmuted.
Can you hear me?
We can, go ahead.
Okay, good. I have a question about the signatures. So I know that you're supposed to be able to view the signature now instead of it just saying e-signature. Is that correct when you print your support plan and you want to see the actual signature? Am I understanding this correctly?
Sorry if you're
That
not hearing me say
You
anything,
are.
it's just because I'm waiting for someone else to answer it. So, but
Yeah, no,
Sid,
you're
you are.
understanding it correctly. Yep.
What was that? There are two people talking. I couldn't. So because mine just still says
You are
e-signature, there's no, I can't see where the person, there's no signature showing up.
Have you
And I
cleared
Have
thought,
you cleared your cache recently?
Yeah. If you could-
Teresa, yeah.
oh,
Sorry.
no, I have not. So hopefully that will fix it. I can do that.
And if not, send it in because it's unusual because we can see the signature printing when we tested this.
Okay.
So for each release, policy tests prior to the release moving to prod. And the piece that you'll hear in all instructions is when the all clear, or when the release is done, if you don't have forms offline to clear your cache. And the reason for it is what happens is then you won't have old data sitting in your browser. So when you log back in, the new data for any changes that were made will default to that instead of what your browser has already saved. And so that's why
Okay.
you hear us say clear your cache.
Okay. And then I have one more question. So when we're in the support plan and there's the little box that says verify signature, is that necessary, first of all, to click? And I found that if you don't click it on the day or right when the person is signing it, if you like, oops, I didn't click it and click it the next day, it changes the date signed date to whenever you click it versus keeping that date as the date signed. And I think that's probably not good because the date signed shouldn't really change. Are you
So
understanding what I'm getting at?
yeah, so from a functionality standpoint, you check the box because that's that person's way of saying, yep, I understand, right? Like you check the box and then have them sign. So I hear you saying though, oops, we forgot it. We want to go back the next day and check the box if it's required. And when we do, it changes the date. That's what I hear you say.
Right, right.
Mm-hmm.
So, I mean, the signature verified, I mean, I just don't know how important that is. That wasn't something that we had in the previous, anything. You just signed the signature sheet and that was it,
Yeah.
But this is just a little different. And I'm just wondering how many people are going to forget to just click that box and then all of a sudden it changes your signature date. And I don't think that should happen.
So that box is not required. So it's not required for the support plan. It's not. You don't have to check it. We're going to dig into it a little bit further and see why you're seeing the difference there, and we'll take that back. But for now, thank you for letting us know. And actually, it might be helpful for you to send that in so that we can work with you further to figure out what's happening with it.
So just send it into the help desk and say this is happening.
Yeah,
okay.
Thank you.
I can do that.
It'll come
All right,
to us.
thanks.
Thanks so much.
Bye.
Okay, bye. Ashley Lang. All right, I'm going to unmute you. Ashley, are you there? Oh,
Can you hear me?
We can.
Oh,
now we
hi.
can.
I was following up on the signatures. I did send a help desk ticket in that date for that date as well. When I went to add in date mailed, care plan mailed, it changed the date to the date I typed in the date mailed. Like it automatic when I went in it and saved it. And I did send a help desk ticket. And then as far as printing, it prints with an X, like an image not able to load. So then I had to go in and print like the internet page to get the signature to print when I mailed out a care plan.
So are you
Since
speaking
the last
to?
release. Sorry, Teresa.
I was just asking for clarification. Are you speaking about a support plan for an HRA or support plan for a MnCHOICES assessment?
It was a MnCHOICE assessment.
Thank you.
Elderly waiver one that I printed you know, like when you save a picture and it says picture not available or didn't load or whatever, it's just that little red X when you print it out. And then I went in and printed the actual internet page, and then you could print it. And then it also changed the date for me when I went in to add in date mailed the care plan. So I hand wrote it when I printed it, and then when you save it, you can like save it as a Word and type it in or whatever the actual date they signed. But it was doing that for me as well.
You're only hearing my silence because I want to make sure that policy doesn't have anything to add. Otherwise, I accidentally talk over them because they can't see it. I'm getting ready to talk because we're not in the same room. So.
We will, if you've already sent in a ticket, we will take a look further and have you, if we haven't responded yet, we will. So give us a chance to take that back a little bit and have a little bit more conversation about why that's happening in that specific plan.
Alrighty. And then I just typed in the changes and mailed. I just typed in the changes and mailed that 6791K, you know, that says there might be typed or written or whatever changes.
Mm-hmm. Very good.
Okay. Sorry, take a note. All right, Katie Kang.
Signatures as well. We use Topaz signature pads, and they do not work in the like e-signature of them. We have to like make them into PDFs and try to use that, but it's been too hard for our clients with disabilities to sign on our tiny little mouse pads on our laptops. So wondering if that will ever change or if anybody's tested them.
I'm wondering, Victoria, can you speak to the Topaz pads?
Yeah, hi everyone. Yes, what you just described is exactly how you have to do it. Unfortunately, the Topaz signature pads are not compatible with the actual electronic signature within the application. But if you print to PDF, you can edit the signature sheet piece of it and use your and that piece has been tested with electronic Topaz signature pads.
Okay.
Okay, Trista Holbus. Hi, Trista, you're unmuted.
Okay, good morning. I did my first MCO HRA and support plan. When I printed the support plan, I do not see my phone number anywhere on the support plan. I see a section that says if you can't get a hold of your care coordinator, and then there's a phone number that would direct the person to UCare sales line. I'm just curious, is there something I'm missing that would get my phone number somewhere on the support plan?
So the phone numbers on the support plan are populated via the organization. And so that's where those phone numbers are coming from. That's where it's tied. It's meant to go back to your organization and not to the person. But we have been hearing more about the phone numbers and are digging into it a little bit deeper. I'm sorry, I don't have a very good answer for you today, but we are taking a look further to see about how those phone numbers are populating and what's happening with those. So
Okay.
we did just get another ticket this week and started working on it yesterday.
Okay. Yeah, because it lists me as care coordinator right in the beginning of it, but there's no phone number or anything for me on there. So I also
Is this one,
I don't
did you send it in to us? Sorry, is it one that you sent in?
I sent in a ticket for a couple of things. I feel like this was one of them. I don't, is there a way to look at tickets that we've sent in to be sure what we kind of losing track of what I've sent?
That I'm not sure. Teresa, do you by chance know that?
I don't know the answer to that, but if you believe that you sent it in and you've heard Beth say that we've had another instance of it, I think it feels like we're aware of it and we're looking into it. So I, I think that you're okay unless you think what you see looks a lot different than what you've described. And you heard Beth say we have an instance of it. So we can at least say we know a few people are reporting it. So I think you're good.
Okay. I also wasn't able to add anything from the drop down on the support plan in the About Me support team member section of it. The drop down would just spin and say, oh gosh, I can't remember what it said, but like looking for or searching or something along that line, and like the PCP who I had entered in the contacts on the person's profile. You know, I figured it would pull from there and then select the PCP to add to their support team, but it just nothing would generate in that area. So I eventually moved forward with the support plan without that on it. Is this a known issue? I know I sent in this was on my help desk ticket for sure earlier this week. Just curious if this is something else, something others have experienced.
It is one that we are looking into further. So
Okay.
just give us a little bit of time. Some of these take some really digging in on our part. It just takes time for us to get there. So just we'll get there. We'll get you an answer. And if it's something broader, we'll make sure everybody knows about it. So just be patient with us.
Okay. Thank you.
Thanks, Trista.
And then Beth,
Okay,
I would like to go on and get through the next few slides because it feels like we're moving into general questions that people have. And since we were supposed to stay to the current functionality changes, I'd like to keep going.
Sounds great.
So,
thank you.
Yep. So I want to talk a little bit about some issues that we've heard you report. They may not be all of the ones that we are hearing today, but I thought we'd cover a few of them so that you are aware of some possible workarounds and so that we can move forward on those. So first of all, we'd like to just thank you. We'd like to thank you for all the screenshots you're providing. I love this little puppy with the smiley face. We really very much appreciate the help desk tickets that are coming in, the documentation that you're providing, which reduces the back and forth. The only other thing that we wanted to make sure that we talk to you about is that, as you know, we can't see what you see. We can't log in exactly like you log in. So those screenshots are helpful. And doc IDs and person IDs are also really useful to us. It limits then what we see when we go in and search for someone. It makes it easier to make sure we have the right person. And again, the sequence of screenshots, I did this and then this happened, or my location assignment and roles are this, and this is what I see. All of that is useful. It helps us when we have to submit any help desk tickets onward to the vendor to have all the documentation that we need. So again, thank you. It might feel like a bunch of work on the front end, but it really makes it the solutioning easier on our end. So for all of you that are doing that, thank you. Thank you. For all of you who will be doing it, again, big thanks. It is much appreciated. So there has been some questions about, so I'm a lead agency security admin, or I'm a supervisor, and I can't change my own information, right? I can't change my own information. I'm unable to update or add information to accounts. And the reason why this is happening is because you aren't allowed to change your own. you have to have someone else change your account. So if I'm a lead agency supervisor and something is the matter with my roles or my email is not right or something like that, another lead agency supervisor role or the lead agency security admin has to make those changes for you. You can't change them yourself. So I just wanted you to understand the why of that. It's a security issue. So that's why you see it like that. And then regarding staff name changes and email changes, if you put that into the Minnesota Service Hub ticket, then we can make the name changes in the system accounts and the system account emails. So even if you make the changes to the staff person's record, the staff member's record, and you say, but the system didn't change their name here. It's because we have to, in the background, make the change to the system account as well. So you can put that name change in. And if there's an email change through the Service Hub ticket, then we will make sure they get changed there. So everything looks correct as you expect it to. So the other thing I want to take a moment to talk about that we're seeing some of, and we have fixed several and we're still seeing new instances of it. So I want to talk about it today. When lead agency security admins and lead agency supervisors assign locations and then assign roles, all the roles should be occurring at this location and role button. Okay, they should not be occurring at organization roles. If you have staff who currently have organization roles, I need you to go back in and remove them and make sure they only have them at the location. Okay. The reason for that is organization roles apply across a whole organization. They're going to disrupt your staff member work, and they're going to have work show up where they don't expect it. Their drop downs may not display correctly. You may have other issues. We will be sending a notice out to folks to let them know we fixed some accounts, and also to let folks know we see some of the other accounts that need to be fixed. But if you want to get ahead of it, please go in. If you know you've created organization roles for your staff, please go in and remove them. And so when you just go here to organization roles and you manage assigned roles and you add roles to a staff member, this is what's causing issues. And so we don't want you doing that. We're actually working on having that permission removed. So currently we are seeing that exist. And again, if you've created staff members and given them organization roles, they need to be removed and the role needs to be at the location and role tab using the ellipsis. So you'll assign the location, you'll click manage assigned roles, and you'll add the roles to the person there. Please follow the SMART guide that is in the Help Center, production adding users for further guidance. The next most common question that I'm seeing are TrainLink IDs and certified assessor credentials. Please know that you can't add the credentials into the system. You should put the credentials in the MnCHOICES or in the Minnesota Service Hub ticket so that they can be added there. You need to know if a TrainLink ID was changed, that you need to notify the MnCHOICES team by putting in a MnCHOICES help desk ticket. The reason for that is TrainLink IDs are not changed by anybody at MnCHOICES. They are changed there. That's a administration change that occurs, and that administrative change does not inform MnCHOICES. So we will need to manually go in and update the credentials both in the database and then in the system. The database collects information from TrainLink directly. So if you have past credentials with an old TrainLink ID, then if the system can't find that TrainLink ID, then your credentials aren't populated. And so we're seeing occasions of that, and we're seeing help desk tickets come in when you see it and you say, hey, the TrainLink ID is not right, or the credentials aren't coming over. It is very likely you'll get an email back from me that says that's because the TrainLink ID was changed and we weren't notified. So just so that you're aware, that is what's going on with that one as well. The next thing we're hearing a bit about, and I don't know, maybe these, Heather, these email screenshots are going to be a bit outdated, but if you have a new access request ticket that comes in, you should see an email that starts with external MnCHOICES account created. Ignore this yellow band. This is just a screenshot that we got from another agency, and their agency adds this kind of caution piece on there. But that's how your staff will know that yes, that email is correct, that they'll get this external MnCHOICES account created. So any new users that get added to the system, this is what they'll see, and then it'll provide them instructions and their temporary password. Please have them do, anytime you put in an access request for staff, have them watch for this email and have them log in and activate their temporary password right away. So again, we have notes here that this temporary password will expire in 7 days. Again, we really suggest that you just hop on it. That if you ever, you say to your staff, yep, we put in the access request ticket, watch your email for this email. And as soon as they see it, that they follow the instructions and go ahead and log in. One of the common mistakes we're seeing, just so you're aware, is see how it goes try that again. Temporary password is, and then it gives it and then ends in a period. Some folks are accidentally copying the period, which then makes it so they're getting the nope, it's not the correct password. And so please make sure that they're not adding the period when they copy. So now we're going to just switch gears to another concern that we're hearing about. And so, Amy, do you want to just go ahead and speak to this slide?
Teresa. Yeah, sure, I can speak to this one. Hi, everyone, this is Amy Alexander. We are talking a little bit about the health insurance information, and we did talk about this at office hours on Friday as well. So for some of you, it might be repeated information, but we thought we would discuss it again because we have been getting some questions about it in the help desk form. And so it's really about that auto load of health insurance information that comes over in that nightly data migration. And so when you're in the person profile, there's that tile on the left-hand side that says health information, and then when you click into that, you can see the health insurance, and that's the that's the information that gets populated in that nightly data migration from Swindex.
Hang on, I'll just put it, show it up.
Perfect. Yep, exactly that, Teresa. So this is what we're talking about, and so there's a couple of questions that we've been getting about it. So the issue about creating a form before that has happened. So if you add a new person to MnCHOICES and you create a MnCHOICES form or an assessment prior to that nightly health insurance data migration happening, you will see what is on Teresa's screen now. When you go into that actual MnCHOICES assessment and you go under that program-specific requirements, it will say no health insurance information records available. So if you're seeing that and when you're running eligibility, it's saying the person's not eligible for MA, and you're like, well, yes, they are. It's likely because you created the form prior to that auto load happening, that nightly load. So any time that you can, when you add a person, if you can wait until that auto load happens before you create your form, that is the ideal way to do it. When you do that, so that the screenshot that Teresa has up right now, when you go into that same area, the program-specific requirements, health insurance information, then you'll see the drop-downs. So if you've waited for that to load, you'll be able to see the drop-downs there. And those can be updated. I know Teresa has some comments on the slide here about when you should update those. Really, you only should need to update them. Sorry, I'm hearing some background noise. You should only need to update them if, for example, the example she has here is it says you contacted the financial worker, say there was a U code, and you got that U code ended. but you didn't want to have to wait for that nightly load for that to update in the system, then you can go into your form and just change the status there, and you can run your eligibility, and everything should be good. So it does allow you to change it in those specific circumstances. But if you create it before that nightly load, it will not allow you to make any of those updates. So that is what we wanted to cover there. If you do have to create it, so you add the person, you need to create the assessment that day because you need to go out and do the assessment that day, you can do that. And then when that nightly load happens, you'll just have to close your assessment as incomplete, open a new assessment, and you can choose to have all the information copied over, and then you should be able to have that health insurance information populated in there. So that was just the reminder we wanted to talk about again. If there's any questions, you can let us know.
Thank you very much. The other thing we wanted to do is just review the MnCHOICES assessment statuses. Partially so that you made sure you knew the order that they were in and then how they affect the support plan and what information comes over from the support plan. So that is where we are headed next. So this is the order that statuses are available. So you'll get incomplete, and once you initiate an assessment, you'll get in progress. Once you've chosen to move to that status, you'll get the in progress status. Then the status that follows that is MMIS ready or ready for MMIS, then pending MMIS, then request clarification. And if you choose request clarification, so if you get to here and you say, yep, I want to choose this one instead of approved by MMIS, it will move your assessment back to in progress. So if you do need to make some changes, and you don't really need clarification, but you do need to make some changes, you can choose request clarification. It will move your assessment back to in progress. Lastly, approved by MMIS is the last one. Specifically, I want to point out to this that for the statuses that have the word MMIS in them, those are the statuses that people need to pay attention to when they think about when to pull data over from their support plan, from the assessment to their support plan. So if they see the assessment with anything with the word MMIS in the status, then you can take a support plan and move it to assessment in progress, and the data from the assessment will pull over correctly. And that's part of why we wanted to talk about this today. There seems to be some confusion about support plans and when support plans pull data over. Okay. What you need to understand is that you need an assessment with one of these MMIS statuses in the status drop-down menu. So you need to either see MMIS ready, pending, or approved by MMIS. So that's the first step. And then the second step is, you can see here the support plan is in progress. When a support plan is in progress, the data for this assessment has not pulled over yet, okay? Once you choose submit, what will happen is the support plan will move to a status in progress assessment complete, and then it will pull the data over. Why that matters is because until that status is changed, you will not see what you expect to see if you think assessment data has pulled over when you created the support plan. And I'm going to give you an example. So I know that Amy Rumsa was talking a little earlier today with us about some folks are reporting that the EWRS tool inside the support plan will show blank, and they're like, how come the assessment data didn't populate? And the reason for it is because the support plan is still in the in progress status. You have to literally choose submit, so it moves to in progress assessment complete. When that will pull the assessment data over, then you will have that tool available for you to do work in. So please pay attention to the statuses to know when the assessment data pulls over. So I'm going to quick go through some resources, and then we'll allow time for questions. The resource questions or the resources are 3 slides long, so it won't take but a moment. So as you can see, the Smart Guide production adding staff and managing user access version 3 is updated. The Smart Guide roles and permissions PDF has been added, and I just updated and added the current functionality and future enhancements document, actually version 6, to the Help Center for both production and for MTZ. So those docs are available for you to use. Let's talk a little bit about what we changed in the Smart Guide production adding users version 3. First of all, we noted in there that the DHS security team will add certified assessor credentials, and that there were instructions in there that your lead agency security admin could add credentials. That was not the case, so we removed those instructions. We also made a section in there about train link IDs are unique, and if you can, please don't change them. And if you do change them, you have to notify us. So that's been added. And then we also added notes on there that said do not assign staff organization roles, because we're seeing it causing issues with drop down menus for assignment and display issues for caseload tiles and other places. And so please do not assign your staff organization roles. It was part of what was added to this document. We talked a little bit about the roles and permissions document our last webinar, and so I just wanted to let you know that yes, indeed, it was posted. So there were no changes made to it, but it has been posted. And it includes who can assign staff locations and roles, so that you're aware of that too, as well as who can assign a person, staff to a person as well. Last but not least, we have been talking about sample forms. If you wanted just to go look at what forms could look like when they're all the way complete, if you wanted to look at them. In MTZ, these are the folks who have forms created for them. You are welcome to go search for that person and look at the form assessment. And for each of it says CADI, DD, SNBC, 24-hour customized living. So you're welcome to look at them. Please view only. Don't work in the forms. Do not create forms from them. Policy uses these folks for their work. And so we really ask that you honor the fact that we're allowing you to go in and view them in the system. That would be most appreciated. So there's been a bunch of time spent on creating assessments and support plans for you to look at. They are not they're not intended to be, this is how it's supposed to be done exactly. These are just examples so that you can get a sense of what they would each look like, because we know that you've had questions about that. So we can take any and all questions until we get to the time that we end today. We are set from 10 to noon. This gives us quite a bit of time for you to ask your questions. And so please, Beth, go ahead and call on folks.
Teresa and Beth, sorry, this is Amy. Sorry to interrupt, but there's a few questions within the Q&A that I thought might be good to quick address about the health insurance before we take questions. It might clear some things up. So there's some miscommunication maybe about when you need to create a new assessment form. So as long as you've waited for that nightly data migration to happen, and you go into the person's health insurance that Teresa has up and there's something there, it might say unknown. That's okay. As long as it's loaded and there's something there, you're okay to start your assessment, and you can change those fields within the assessment. If for some reason it's saying unknown, you confirm with the financial worker, oh no, their MA LTC is good. You can change that within your assessment form. You just have to wait for it to load. If it says unknown, it's okay, because there's been some miscommunication that people think that once the person gets their MA, you have to restart or do a new assessment. You don't have to. The only time you have to do it, close it and start a new one, is if you didn't wait for anything to load there and this page was blank. So I just wanted to clarify that, because there's a few questions. Yeah, okay, thank you.
Yeah, and so Amy, the only other piece I would add to that, right, is the training zone is people expect to see this, right, what I have up. But the reality is we created this for the training zone so that they would have available to them kind of the insurance possibilities so that they could practice. But the
Right.
reality is this might have one line on it that says unknown, but that you'll still know that it's loaded. And so as
Yeah.
long as there's some data in here, the job is loaded. Doesn't have to
Right,
be full
exactly.
data, just some data.
Right, and if it's saying, yep, that's a good point, Teresa. And if it's saying unknown, and you're like, why is it saying unknown? We had answered a couple questions about that. There could be a U code. Sometimes that's the issue. So if it says unknown, you'll want to confirm their status, before you would go in and change anything within your assessment. And you can let us know, like if it says unknown and you've checked everything out and everything looks good, definitely, put it on a help desk form or talk to your mentor and let us know. But don't let it hold up your work, because you can change that within your assessment form. So you don't have to let it, if you go into that program-specific requirements, it's about the fourth-ish, there you go. You can change it right within there as long as you've waited for that to populate. So don't let it hold up your work. If you're seeing unknown and you can't figure out why, let us know so we can look into it and make sure there's not an issue with the data migration that's happening, but you can keep trucking along with your work. So just wanted to clear up that in case I, misspoke about it and caused some confusion. So if there's still questions, let us know, but thank you.
Okay, our first question is from Lisa.
I have a few questions because I didn't get to ask them on Friday.
Go for it.
I think some of them have already been cleared up. I was having issues getting when I was adding contacts, their names or phone numbers or addresses, various information wouldn't pull. I'm thinking that's because I probably created the form before I added the contact under their profile. Is that correct?
I am guessing that that is indeed the case, that you created the form and then added the contact instead of adding the contact and then doing the form.
So if I create the contact before I go out there using existing people that I know and they've changed, and then I go back in there and change it from there, then will it pull?
Sorry, I was
Looking
right.
at a specific form.
Yeah, so
Right.
under the profile, when you go in and you have to add all their you add their contacts and you can add their name preferences and all that other stuff. And then when you're done with that, then you can go in and you can create your form from there.
Mm-hmm.
When
and so is it a specific form that you're speaking to is what Beth
Oh,
asked
sorry,
you?
the reassessment. All I do is reassessments.
Okay. Well, in the person profile information, it really varies. I mean, you can enter in a contact after you created your assessment, and it would populate, it would update the contributor list. You know what I mean? Like you'd be able to go through and add that person as contributor to the assessment, or other areas of the assessment where you might need to update. There are just certain fields like diagnosis. Diagnosis will update too. But there are other certain fields, and I'm blanking on what they might be at the moment, but there are certain fields that you can't update and won't carry into the assessment. Amy, do you have an idea of a specific field that I can't think of at the moment that won't update in the assessment once you created it?
Is it in the practice guide?
I'm able to add all my healthcare providers and see their name after I've created the form. The problem is it's not pulling the address, phone number, or any of the other information I put in. It's only putting their name.
Oh gosh, I'm so sorry. On the assessment summary, I'm missing that. Yes, on the assessment summary, that's a known issue at the moment. We know that that's not working, and we've documented it, and it's going through our review process. So we are, that is a known issue. Sorry, I just didn't get there with the addresses that it was tied to the assessment summary. I was thinking you were still trying to pull contacts into the assessment.
Nope, it's the assessment summary.
Yeah,
so
no, yep. So just right now, you just have the names there, and you're good. There's not really a workaround. You don't need to necessarily add the addresses in. And so that is, it's a known issue that is in process. So.
Okay. Another question that I ran into is I enter my own screening documents. So when I'm changing my status, I can't think of the right word right now, to MMIS ready, and then it has to go to the next steps. Does that take like a refresh or an overnight update in order for me to be able to change the status again so that I can approve it and move it to the next phase?
Nope.
It does not.
Where does
It does
that
not.
notice go? Because
So
I did one and I put it in that status and I didn't know how, I didn't have the options to move it to another one, like until the next day.
no, well, those statuses in for the assessment, you can go right through them one at a time,
Right, they're
right
sequential.
in the same sitting. They're not tied to MMIS yet, but they're for when we are working with MMIS and we have that integration with MMIS. That's why we have those statuses in there. And so, but there's nothing tied to them. There's nothing preventing you from moving one to the other. If you enter your document in and you're good and don't need to make any changes in your assessment, just move those statuses through and close it as you
Okay,
typically
see, and I
would.
didn't have that option when I did it. When I've taken one through the whole process, I had to wait until the next day to see the rest of those options so that I could change it to the next status and move forward.
Well, I want to wait a second. So you don't see them all at the same time. So that's what I was trying to bring up, Carla, so I could pick one where I've
Yes,
gotten
like I can
assessments.
do the MMIS ready. I can put that in.
Yep.
And then I didn't have the option of switching it to approved by MMIS or whatever the next status is.
Okay, so yep, so when you do this, right? We're just gonna do it live.
Yep.
So then it switches to this. You should have the next status should be sitting here.
Okay, and I didn't until the next day, so maybe I just missed something. I'll try it again.
Yeah, no, it should, like Beth said, it goes sequential. And so even if I did this one next, right? Then it went to pending MMIS. And then here's where I can choose request clarification and send it back to in progress, or I can make it so that it goes to approved by MMIS.
Maybe I just missed something and I'll try it again. And if it happens to me again, I'll take screenshots.
Sounds good.
Yeah, let us know for sure. That's unusual. We haven't seen that before.
Right.
Okay. I still have 2 more. And then I had a worker just message me and ask, how do we put an end date for Medicare Parts A and B on a screening document for AC? Like the system won't let her put the 99s like MMIS shows.
So is that?
It's on the current functionality document.
Okay. You tell me where and I'll direct her
but I don't know the.
I'll see if I can find it and I'll put it on the screen if you want to ask another question, but you should just be able to go into the current functionality version 6 and use the find and put 99 in it and it should take you to it.
Okay. I will try that. And then my last one, and this might be too detailed for this, but I'm trying to, when I'm doing my reassessment and I know the person has historically qualified for PCA, but is not using it because of different programs or where they live, I don't necessarily know how to answer all those questions so that it says that they're still eligible, even though they're not using it. Because like there's pieces of it that are under program specific information. There's a piece of it that's under community living, under self-determination, and how you answer some of those questions all play into eligibility for CFSS and PCA. I'm having to play around with all of them to get them to say that they're eligible, because I know that they're eligible for PCA even if they're not using it.
Well, if you're getting stuck, I suggest sending it in and we'll help you get there. We'll help tell you why exactly it's not working or why it wouldn't be showing eligibility. I would just say that don't get too stuck, ask us. We'll help.
Okay, yeah, I will. The next time I do one, I will just, yeah, I'll send it in for a question.
Okay.
And then I got one more email, and actually I just got asked to, how do we get them off your caseload? So do we unassign ourselves to get it off your caseload once you're done with it?
Yep.
Okay, that's what I did, so I did it right.
Based on your agency's instructions, of course, but yes.
Okay, that's how I did it.
If your agency says to do it, yes, you unassign yourself and you should, again, follow the instructions.
Perfect, that's how I did it. Thank you. That's all I have. Thank you.
Okay. Yep.
Okay, sorry, I'm trying to get through the chat too. Jennifer Saring. Hi, Jennifer.
Everybody. So Elizabeth, you and I have been chatting back and forth, but I just wanted to kind of bring up to the whole is I have 2 different elderly waiver providers who are eligible to do 24-hour customized living. And I cannot get either of them to go through with a customized living rate with the T 2031 and the plan T 2031 with the TG for the 24-hour one. And I am having difficulty in just, I keep getting the same error that provider is not available for the service. And it just,
Right.
I've gone through it several times and I'm like, what? Is it something I am missing? And I have people eligible for 24-hour or 24-hour customized living with the TG.
I think you're running into a known issue. Amy Rumsa, are you able to talk more about the 24-hour customized living? I didn't realize you were speaking specifically about an EW service when I was just running back, because otherwise we have been seeing some issues with just a few here and there of providers, and we've just been asking if you send it in, we'll take a look at why it might not be working. Sometimes it's an issue with the provider, and sometimes it's an issue with how it's set up. So send those in, but
can you hear me, guys?
We can.
All right. Yeah. So when did you try to add these services? Was it like within the last week?
Actually, I just tried to do it right now, and I did screenshots, and I did the regular T 2031, and I was just going to go through, and I was going to attempt to do the 2031 TG, but I'm getting to the same one that program or the provider is not available for this service.
Send that in. We've had this happen before where it's a behind the scenes thing for us. It's the way that we put in
I did send them in on Friday, but I was just wondering if anybody else was doing this, because I'm fine really, but I do need to start with the new rate starting on September 1st.
Yeah, I know that there's been various things that we've found that just are on the backside, our own codes needed to be fixed. But yeah, if you sent it in, I'll be the one looking at it. So
just to tag on with that, I did have the one provider call into the number provided, because I did do an original ticket back in the middle of July. And she did call in, and there was something about her license was up for renewal, which it already does, or it already was renewed. So it's just, it was renewed as of August 1st, but they already had the information that it was already renewed. So just, that is my number one issue right now, is getting in the rate plans for, I have 2 people.
Okay, yeah, I will definitely, I just was looking through all the questions I had quite a few right now, but and I saw the one about the provider. So I'd have to call over to provider support and see what happens. But yeah, and I did. So I'll hoping to get to those.
Hey, and I'm just gonna tag on. Actually, I'm actually pleased with how the assessment is going. It's just we're just having, a little bit of hiccups with the support plan, but overall, I think we haven't really had any issues here in Dodge County. So I just like to tag that on as kudos.
Thank you. We appreciate it.
Okay, thank you. Teresa, can I go forward or no?
Amy, do you have anything else? Otherwise, we'll let you check it out and figure it out.
Nope, I'm good.
Okay, Annie Braun. Hi, Annie.
Annie, you are off mute, so you are welcome to speak. And if we can't hear you, it might be you have yourself muted as well.
Oh, can you hear me now?
We can.
Thank you.
Perfect.
I was double muted.
Yep.
Okay, I hate to go back to this, but I am still confused about the health insurance information loading, and I just want to be clear. So if we're pulling a person in and you would create a form or create an assessment right away before the information is loaded, then it will never load for that person?
Correct.
No,
Okay.
No.
it will load. It will load in this health insurance what Teresa has up right now. It will load there in the nightly load the next time. But your form that you created, like your MnCHOICES assessment form, will, if you created it prior to that load, it will never show the person eligible for MALTC. And you know, for some programs, maybe that's okay, but for a lot of the waiver programs, they need that MALTC status to be showing. And so if you create it before this, the issue is you're not able to change it within that form because those drop downs are not even there for you. So then you have to create a new form.
Meaning creating a new assessment.
Yep, create a new assessment. Yep, exactly. And then you can choose to have everything copy over. But yeah, so it'll still load for you that night. It just won't update into the form that you've already created.
Okay, got it. Thank you.
Okay, cool. Yep.
Okay, Lisa. Hi again.
I'm sorry, I didn't unraise my hand.
Oh, all right. Julie Mardinsky.
Good morning. I just had a question about the DD screening document. When you print it, it does not show the field numbers. And I wondered if that's something that's going to be worked on because it's really hard to cross-reference in the scenario and the DD code book without those field numbers. So I was just curious if that's something that's being worked on or if it's not ever going to be a process, part of the process. Thank you.
Well, the form numbers in general, you won't see them on LTC either. It was intentional that they're not included, and more work needs to be done with the code book and tying things together with the actual questions. And so that is future work that we're going to continue to do. But we don't have plans to do it. But if it's something that we hear more about, we can definitely take a look at deeper. So,
okay. Thank you.
Thanks, Julie. Okay, Bree.
Can you guys hear me okay?
We can.
Okay, perfect. One, we kind of just wanted to piggyback off of, I don't remember who said it earlier, but when we were talking about some providers, like when we put health providers, such as like a primary doctor, when like before we're opening a form, I know that she was talking about with her reassessments, it wasn't showing up, but we are also finding it's not showing up in the support plan. Is there a way to fix that part of it? Or that was kind of my first piece.
I'm not sure what you mean by form numbers.
Well, so when we are entering the client's information, like, health and insurance, kind of anything that we are entering demographically, and we are putting like health insurance providers, for example, they aren't pulling over into the support plan.
After you've updated them, is that correct, Bree?
Yes. Yep. After we've updated them.
Mm-hmm.
So this is Jerry, I'm in the room too, and so I'm the first one that has gone through the entire process, and so like on the support plan, the address isn't coming over, any of like the primary, the psychiatrist, any of that is not coming over. And on the CSSP it shows, but on the support plan it is not. And that's kind of important information that needs to go to our providers.
So you're speaking about the revised MnCHOICES application and the assessment summary. Okay, thank you. Okay.
On the support plan, will all of the provider information, emergency contact, address, will that stuff pull over? Because we couldn't get it to come over into the support plan.
From the assessment.
Right. No, there's some demographic information on the last page of the support plan. that was intended to come over, but the rest was not. So the rest of like all the person profile information wasn't necessarily meant to come over to the support plan. So if there are things that are not on that last page of the support plan that you'd like to see on that support plan, please let us know. That'd be really
Yeah,
helpful
we
to send that.
definitely want all the providers and the address and emergency contacts, all of that to come over.
Because otherwise, for right now, is there, would we just have to print a separate form to include to send to providers along with the support plan?
If that is your practice to do so.
Well, it wasn't separate prior, it was
sure
on
how
our
that works.
actual CSSP. So there is no practice because before it was on that report and now it's not.
Right. Yeah, it's a new support plan. Definitely a new support plan. So again, if there are fields that you want to see on it, please let us know and we'll work on getting that to you.
Sure. Just send it into a help desk ticket.
Yes, thank you.
Okay. I do have one more question, or two more questions, if that's okay.
Go for it.
The one maybe is just a quick one. I couldn't remember with our training, but is there a place in the revised MnCHOICES to put medications that the person is taking?
With the staying healthy section, you can record medications.
Yep.
Could you show?
That's where I was gonna go find one that I have a staying healthy port. Did someone have one in MTZ I can look up quick? I was gonna see maybe which ones there were for the samples.
Yeah, I don't know, Kathy, do you have an example in an example assessment in MTZ, the staying healthy section? I'm not sure I do.
I can look. I'm not logged in right this second, but I can look.
I think Mark McDonald has the MCO staying healthy.
McDonald does? I will try.
I think so.
And I'm going to where, I'm sorry, it was the assessment. This one. Do you want me to use the approved by MMIS one? This doesn't look like it has staying. Oh yes, it does have staying healthy. Okay. So there's a section on medication. Tell me where I'm supposed to be going, folks. Flu vaccination.
Because when we look at it, we do see the medications part where you just referenced.
Right. Mm-hmm.
We aren't seeing if there's a specific place to put the meds that they are on.
What I remember from training is that we have said if they have a medication list and you want to attach it, you could put it as attachments.
Ah, okay. Yep. We just weren't sure if there was a place in the actual assessment tool anymore to do that. So we could just upload it as an attachment then, it sounds like.
Is that okay policy to do that?
That sounds wonderful. I'm thinking of another plan, so apologies.
This is Sue. The question is the medication list attached to the person's profile, yes or no? So I think that if you did attach it, you would indicate yes.
Yep. So I mean, I have a few, I have a health risk assessment person that asked that question in the medication section. But again, like Sue said, it's just that question of if the medication list is attached, and it allows you the opportunity to select yes or no, but then you'll go to your attachments to add that in there.
Okay. Yep. We'll do that. And then Teresa, since you are in that, could you go to that person's, like Mark's, I guess what you call homepage, the dashboard? Oh, I'm sorry. Maybe go to, it would be all of your clients' dashboard. So we,
Yeah, go ahead.
we just have a user who said that their caseload, that tile there, when they scroll, it stops at about J of their client list. Is there a way to change that? You know, they have obviously clients that end.
So this caseload tile will only display the first 20 cases, the most active ones.
Okay.
So any beyond that, they have to search for or use their queries to go to my caseload to look someone up.
Okay.
Okay.
Sounds good. That was all that we had. Thank you.
Yep, you're welcome.
Okay, Bethany. Oh, Bethany, you took your hand down, I think. Sophia Christian.
Just because I'm not sure if I heard it right. So when they do when we go in and do an assessment and they click for it to go over to MMIS, that is being transmitted to MMIS, or do we still have to manually do it ourselves into MMIS? I was a little confused by the comment that was made.
So is the question being asked as someone who does MCO or MCO delegate work?
Yeah, MCO delegate.
Okay, Rikio, you can go ahead and fill that one, please.
Sorry, I don't think I heard the question. Can you
So
repeat it, please?
yeah, go ahead and ask it again, Sophia.
Sure. So when we have a care coordinator completing an assessment in MnCHOICES and they click for it to be submitted into MMIS, I thought I heard a comment saying that right now it's not transmitting into MMIS. And if that's correct, if that's true, then do we still have to manually do it ourselves in MMIS?
Yeah, so you're talking about the MnCHOICES assessment, not the HRA?
No, the HRA, we're an MCL that does not do MnCHOICE assessments. We just do HRA and support plans.
Yep, so if you're entering an HRA into MnCHOICES, then you no longer have to enter the HRA data into MMIS. Nothing automatically feeds into MMIS, but the data will be available in the MnCHOICES system.
Okay, so then do we have to, in order to get it into MMIS, do it as we currently are now, where we, they fill out the HRA, transfer it to an LTC, and then we enter it into MMIS?
So in MnCHOICES, if you're talking about MnCHOICES and you're in MnCHOICES filling out the HRA, then the HRA in itself does not produce a screening doc.
But all that information transfers into MMIS, so we can, no, it does not.
Nope, it does not, and it's no longer, the MMIS entry is no longer required if you're completing an HRA only, because that information can be gathered from the MnCHOICES system.
Okay.
So you're going to be getting it out of MnCHOICES instead of MMIS.
Okay, and so when is MMIS being deactivated?
So I think she means, and maybe you can help me. So you're asking, when has that policy been instituted? You're not, is that the question?
Since we have a long rollout to get everybody onto MnCHOICES, I can't remember when the final cutoff is to have everybody using MnCHOICES. But if some of our care coordinators aren't maybe starting until later in the year, we can still enter into MMIS using our LTC screening document, as long as they're not entering into MnCHOICES.
Yep, and that's correct. So if you're still using the paper assessment, the legacy assessment, that legacy assessment, you will continue to follow that route of entering that legacy assessment into MMIS. But if you have fully transitioned into MnCHOICES and you're completing the assessment in MnCHOICES, then that MMIS entry is no longer needed. So it kind of depends on where you're at in the process and if you're still using legacy or if you're fully in MnCHOICES.
But at some point, legacy does end, correct? For MMIS?
When you're no longer doing legacy and all in revised MnCHOICES application.
Okay.
That's what I heard Rakia say.
Okay, thank you for the clarification. And I have no
Rakia,
question.
Rakia, I didn't misspeak, did I?
Nope, I think you're right.
Okay.
Okay, thank you.
Okay, Madonna. Hi, Madonna.
Good morning, everyone.
Good morning.
Good morning. My question has to do with the outage yesterday afternoon.
Yep.
I would like to know, is staff able to print the PCA service agreement now in the support plan? Because we haven't received any updates from DHS.
You got an all clear, and an all clear should mean that the fix is complete.
Okay.
Teresa, I'm not sure that, I think we're having issues finding the all clear.
Yeah,
So
we didn't
we're
get
still working on
it
that.
all
We'll make sure
clear.
to get that out. Yeah.
Okay.
But that was what the fix was. The fix was to allow you to print out the type B service authorization. So if you're having any difficulties with that, please let us know. But you should have that functionality as of today. Clear cache.
Thank you.
Thank you. Kelsey Peters.
I think I might be double muted.
Nope, you're not. We can hear you just fine.
Okay, perfect. I just wanted to get clarification on the 24-hour CL providers that we're trying to add into our support plans, but they're missing that code of service for the 24-hour CL. Is it correct that we should send those into the help desk and then the MnCHOICES team will make those updates for those providers so that we're able to use them in the support plan? The ones that we know they're currently 24-hour CL providers. It's just that maybe those codes didn't get input into the support plan.
Amy Rumsa, did you hear that question?
Okay, yep, I did. Sorry, there's somebody mowing the lawn outside. So there's a couple different things that could be going on when that happens. It could be a code on our part, and then you heard somebody else talking about it could be that the people really can't provide that service because maybe something has lapsed. Or are you talking about the person themselves not being eligible for 24 hours?
It's the provider, like the CL provider. And we believe that they are a currently actively enrolled provider. We're currently using them. We don't believe there's any lapse. I believe they didn't pull into the new MnCHOICES revision support plan correctly.
So did you try authorizing regular customized living? I'm just curious.
Yeah, I think they had a lot of codes of service. They just didn't have the 24-hour CL for EW.
Yeah, we have had a couple situations. One is a defect that's going to get fixed, and so the workaround for that would be that you just authorize regular customized living. Make sure you're clicking the box of that summoning device, and then just don't go over those 24-hour limits. It'll allow you to go over the regular customized living amount. You'll get a warning, but not an error. So if you need to get those done before we can research this, just authorize the regular customized living. I mean, the unit prices and everything are the same. The only difference is that summoning device and then the case mix limits.
All right, sounds good. Because I think we had sent that in as a help desk ticket earlier in the initial release, and we're told to have the provider call the provider help desk. But we felt like that wasn't the right option because I really do believe that they're an enrolled provider. It's not an enrollment issue. It's just
Yeah.
how they got imported issue. Okay.
Yeah. So try doing the 24 or the non-24 hour. And then make a note somewhere. You know, so that anybody reading it would know that it was supposed to be 24 hours.
Okay, sounds good. Thank you.
Mm-hmm.
Next question. Beth, you're on mute. I'm unmuting you. Go, you're unmuted.
Oh goodness, I heard the reverb that we were getting, so I went on double mute. Apologies, everybody. Bill Caven, I've unmuted you.
Hi. So I had a couple questions. I'll start with the real basic one here, I guess, is people have been asking about the changing the password every 30 days. Is that something we're able to do just by going into our account and hitting reset password?
So you can just use the forgot password option and change it there.
Okay.
I don't know where the reset password functionality sits, so I'm sorry, I can't
Okay.
answer it.
So just
But
use the
you
forget
can use the
password.
forgot password.
Okay. Okay. Sounds good. Second question has to do with the insurance thing again. If we do a lot of assessments that people are pending MA at the time, you know, and they may be pending for 30 days, 60 days even. When we do the assessment, are we going to have to like do an incomplete and re-go back in there again once they do get approved for medical assistance so that it shows that they're eligible for LTC?
I'll let someone from policy handle it.
Okay.
Yeah, I can. This is Amy. As long as you wait for the nightly load to happen before you create your form,
okay,
you don't need to create a new assessment. Even if they don't have eligibility or it says unknown, doesn't matter what it says. As long as you wait for that nightly load to happen, you can start your assessment. If 10 days later, 15 days later, they get their MA in place, it will reload and that auto load that night. Or if you can't wait for that night, you know what happens, you confirm with the financial worker, like, yep, everything's good. You can go into the form and change that status to eligible. The issue is if you do not wait for that load to happen when you start the form. That's where the issue is.
Okay.
As long as you wait for the auto load to happen, it doesn't matter if they have MA or not. It's just you have to wait for that to happen, that auto load to happen. So.
Okay, sounds good. Thank you.
Yeah.
Okay, Emily Gerard.
Good morning again.
Hey.
I have one that I am hoping is easy. We'll start with an easy one. Does DHS have like an expected best practice as far as how we handle addresses in the system? I see that there's an option to kind of have a running list where you end date the previous address, add a new one. Does DHS prefer we do it that way or just overwrite an address to the corrected one? Or do you not care?
Well, I typically enter in an end date so you have that history of like, you know, like a past address in case that might be a past current address, you know, so that you're not having to redo any work. So I would end date it and then add in a new one.
Okay. Yeah, I think my only concern would be if we get to be like 3 years down the road, somebody may end up with 15 addresses, but for now, I'll tell my staff to do end date and add a new one. Okay.
Yeah, we can take a look at that as you go through, but I don't think there's harm in doing it the way, just ending the date. That's what's intended by the system.
Okay. Yeah, and I haven't like stress tested at all to see like how many addresses could we add or how many pages will that make a printout or anything like that, but okay. Sounds good.
Yeah, I don't think you'll see much of that, but okay.
Perfect.
Awesome. Thanks, Emily. Oh,
I
do
have
you have
one
more?
more.
Sorry.
Well, I have a few more. With the
Okay.
OBRA, currently it seems that the only option for selecting the assessor that's filling it out is to scroll a large list, and that we can't seem to type to jump the list. So like a staff that's name starts with V has to scroll many, many, many assessors. Is that the intended function, or?
Not necessarily. It is on our list that it is something that we will fix in the future.
Perfect.
It's just getting to it. We know that it's cumbersome. We've been hearing that for a while from you guys, and it's prioritizing without
Totally,
with the other
totally
stuff.
understandable.
So
That's not it's not a priority.
we'll get there, but
That's good to know
yeah.
that it's on the list though. And then I've got a couple that I can save for the MCO call next week, but I'm wondering if maybe a future launch call or at some point if there could be some more discussion around support plan and the goals section. We're still finding this quite difficult to navigate and kind of understand the my action items and how that's supposed to play in versus just a goal statement. And I'll take a look too. It was helpful to know that there are like pre-written plans in the training zone that we can look at as some examples. But as we're getting into the support plan, we're just really struggling to figure out how that's exactly supposed to work and the best way to make it efficient for staff. And reviewing the TrainLink information hasn't, we understand that you have to enter a my action item and then you have to enter the goal statement later, but the whole process is just causing a lot of confusion. So I'm wondering if that could maybe be a discussion at some point, not necessarily today, but maybe at a future launch call or office hours.
I have noted it on my
we can
list.
take.
Awesome.
Yeah, we can take that back. One thing to note though is when you're looking at my action items, really look at it as what is the person responsible to do. You know, it's what you're doing now, what you're doing today in the support plan about writing what the action steps for the person. So what is the person going to do to help them achieve this goal? And that's all that goes right there. So
okay, I think the reason it's confusing is because you have to enter the action items first.
Yes. Well, you should enter the goal first so that you have it clearly kind of identified in your head, and then you kind of go back to, attaching it, entering in the action item after that. But I see where it makes sense to enter it in the action item first, but you can enter the goal first, that's kind of the workflow is to enter it first and then go into the action item because that makes, more logical sense and process. But we understand, we've heard
Having them be like
about the support plan and how that works.
They have to link together. It's just causing some confusion.
Yeah.
And for care coordinators, they're just wholly confused because they don't have the current, like, what's the person's action steps. I mean, they do in different forms, but they're just not familiar with the current terminology. But yeah, that'd be great. Right. That could just be a future topic of conversation.
Yeah.
My last
This one is just a little hard. Yeah. Oh, sorry, just let me, one more thing. It's just a little hard because we are dealing with some out of the box functionality and this is part of it. And so that's kind of, it's how the system works.
Yeah.
And I know that's not the best answer, but we'll continue to talk about it.
Awesome. Perfect. Last piece for today, with the support plan, there's a lot of questions that like telescope out based on how the person answers the question, like about employment and housing and things like that. Is there any way to just see a full overview of what all of those questions are without clicking through it? So if a case manager were to not have the plan pulled offline to go to a visit, things like that, is there a way to know exactly what all those question options are? Or is the only option to have their computer with them, have a support plan offline and go through it that way?
That is a really good question that I'm not quite sure of. Whether or not there is an option when you're offline like that. I don't know. We know that we are creating a kind of a note support plan for you to be able to have an idea of something to take notes on when offline. that would have that detail, but I'm actually waiting if Kathy or Victoria want to add anything in here.
Yeah, I'm just thinking that it certainly case managers could bring their computer and have the program pulled up, but that is not necessarily a practice so far and would be a little bit of a jump if there's oftentimes a lot that a case manager needs to accomplish at a visit with a person, and having the MnCHOICES system pulled up in front of them is not necessarily a high priority while they're doing the rest of their case management work. So just if there was a way to have like a cheat sheet of those questions.
Yeah, hi, this is
Yeah,
Victoria.
oh, thanks,
I was just
Victoria.
yeah, this is
Go ahead.
Victoria, and I just want to let you guys know that we have created a blank support plan note-taking tool. It is in the works of getting finalized, and it will eventually live in the help center. So when we have a date of when they are up and available in the help center, we will let you guys know. But we do know that that was a need, and it is coming.
Awesome. Thank you so much. Yeah, and for care coordinators too, since they can't yet have their support plan ready since their HRA is open. So that's great. Awesome. Thanks, everybody.
Okay, Becky.
My question is, I was just hoping that maybe you could demonstrate again how to add a person if you're not able to locate them when you're doing the search.
I am happy to show you on MTZ. Just know, right, that production looks a little bit different. So I'll just do it simple using the search up here, and we'll just create a person whose name's ABC name, just for, because it's the first thing I thought of. So yep, this person's not here. If I would have put them in the advanced search, they wouldn't be here, right? So I go add the new person. Again, we'll just stick with my poorly named name, but at least it's a name. I would add a birth date. And I'll make up a PMI number. And so what you're doing here is, even though it looks like you're creating a new person, what you're really doing is saying, does this person live in the MnCHOICES database, and is this person also potentially in the MMIS database? So you're giving it, this is just your next level of, you add a new person and it searches kind of through the databases one more time to make sure you don't create a duplicate person that you don't intend to do. So in this instance, we do continue. You can see it goes from enter information to potential duplicates. And because I use PMI 1, 2, 3, 4, 5, 6, 7, 8, there's a whole bunch of them in here. But nope, these two people don't match my person's name. And so I'm going to do continue. And then what it'll then do is it would, if this were production, it would go to MMIS Swindex and look for that person there. If that person existed, that information is there, then instead of, if I hit continue, it's going to create a new person because this is MTZ. But if I hit continue and the person existed, you would see the person's name would show up, and then you could choose to import if you wanted to, or continue creating the new person. And so you'd have the ability to import the person, and then their data and everything would come over from that search, and then you could then work with that person. If that person doesn't exist in that data search, then it will create a new person. Does that answer that for you? Do you feel a little more clear about it?
She dropped off. So Christina Bailey.
Hi, can you guys hear me okay?
We can.
Perfect. So my question is regarding the support plan and mid-waiver service changes. So we are confused if data from the current support plan will copy to the new support plan, or if the new support plan will be blank.
Sorry, I'm just waiting for someone from policy to choose to
Yes.
answer the question.
Sorry, I'm processing a question. So you can use the revise function within the support plan to copy your current support plan into a new version. And so you'd use the revise function and your data will copy in, so it won't be blank. When you're creating a new plan, the data will be blank.
Okay,
So
and
a
where's
new plan or like an annual reassessment.
okay, and then where's the revise function at?
It's a
So
status.
this is where you use, no, it's where you use the tornado. You'll use the tornado from the forms page to select support plan, and then you'll use the let's sees to select revise on the plan on the closed plan that you'd like to revise. And there is where then you'll be able to revise and create a new support plan. It'll walk you through the steps and ask you if you want a signature page and everything else that you might need for a support plan. But there's Teresa, there's training about this.
Yep, there is.
Yep.
Sorry, I was trying to find a plan, but
yeah, I don't know that we can point specifically to it at the moment, but there is training that walks you through, and there is I believe there's smart guides about revised functionality. If not, it's in the support plan guidance.
Okay, thank you.
Again, Victoria or Kathy, jump in. Okay, I am going to go to Abby Cool. Abby, you are unmuted. Okay, I'm going to move on. I am going to unmute Fillmore County Public Health.
you are off mute.
They lowered their hand. Okay, so we just answered Christina Bailey's question, so I'm going to lower your hand. Becky, I still have your hand raised. Abby Cool, Bethany, Maria, Jolene Nelson, I'll unmute you. You're new to our list. Jolene.
Hi, this is Jolene. Can you hear me?
We can.
Oh, okay. Hi. A couple of questions. Where is the section where you can type in the medical provider name? Somehow I cannot find that.
It's under context in the person profile. Yeah, Teresa, it'd be great to show them.
Yep, sorry, I'm getting there. I just feel like I've swirled too fast and then the poor people have to. So you can pick professional medical, correct?
Oh, okay. Okay. Okay, thank you. And also the whole issue about the pending medical assistance. Because a lot of times we do initial assessments and we're always waiting for the medical assistance. So once the medical assistance is open and effective, do we go in and change it, or does that automatically get changed in the system?
So the question that you hear her asking is, will the nightly load update it in the system, or should she edit it in the assessment?
Hi, Teresa, this is Amy. Sorry if that was a question for me. I was answering questions within the Q&A, so I'm sorry. Could you repeat it one more time?
So the question that she was asking is, so she's got an assessment that has been open and is waiting for MA, right?
Mm-hmm.
And she wants to know is when that changes in the system, will the nightly load update the MA, or does she have to go in and edit the MA?
Yep, the nightly load should update it for you. So every night it's running and it's pulling the most updated information right into that health insurance information. tile. So if you wait for the nightly load, it should update, but in those instances where like, you know, you got it confirmed and you want to run the eligibility and move on with your work and not wait, then you can change it within the actual assessment form as well. But every night this should refresh and update with updated information.
Okay, and obviously I haven't gotten to this point yet, but once a few times we've had to do the whole eligibility update because we're still waiting for something with the medical assistance. Do we do an eligibility update somewhere? Or do we have to do another assessment?
So Amy, is that information in the practice guide for the MnCHOICES assessment? I was trying to remember where that is written. So if they want to return to it later after today, where would they find that?
Yeah, it should be there. And Beth, you can respond to it. I think it should be in the practice guide. But yes, you're able to do an eligibility update within.
Okay, I haven't gotten to that point yet, but okay.
Yeah. Yep. You just, when you're selecting, when you're creating one and you're selecting it, it'll ask you, it gives you the option when you're initiating the assessment for the assessment type.
Okay.
And you can.
If it's within the time frame, you'll be able to select eligibility updates. So.
Yep.
Okay. Thank you.
Yep.
Oh,
Okay,
you should be able to
Sabrina.
find it in here.
Oh,
go ahead.
Okay, I'll move. Oh. Sabrina, you're unmuted.
We can hear you. You're good.
Okay, so within the staff assignments, I was wondering, as a support staff, once I assign it to a certified assessor, do I unassign myself as a support staff?
If you're going to be providing other support to that person, you know, as it goes through the process, you can remain on it. If you aren't doing anything else, you can unassign yourself. So it depends if you need to follow up or do any other work on that, and you want that person to show up in your caseload.
Okay, so like if I have to enter like the screening document or anything, then I should stay on there.
Yeah, because that way that way it'll be easier to find that person. You'll be able to go do work. You'll be assigned, so you'll be able to do the work that you need to do in that person's record.
Okay, perfect. Thank you.
Yeah, you're welcome. And we are at noon, folks.
Hey, Teresa. We are at noon.
We are at noon. So I just want to say again, thank you everyone for today's conversation and our I'm glad we had as much time to answer the questions that you had. Please know you can go to the training archive web and click MnCHOICES and go back and listen to these. They're both, the PowerPoint is there and the recording is there. And the recording usually gets there under 5 days. So you can go back and listen to recordings if you would like. And so other than that, we just want to really say thank you. This was a good opportunity for us to have discussion and really talk to each other and to listen and answer questions. And so we appreciate that time very much. And please have a really good rest of your day. And we look forward to speaking with you again next month. So thanks everyone. And we will be going off. So thanks. And Anna, you can end the recording.